exactly is hospice? What do you guys provide? What do you do? I know that was three, but it all lines up as one. Hospice, as defined by Medicare, is for anyone who has been diagnosed by a medical physician with a serious illness of 6 months or less, a life expectancy of 6 months or less. Now, when we say serious illness, we're not talking about just a chronic condition. We're saying a serious illness that has no cure at this time or irreversible. You've reached the terminal capacity of this illness. It is a difficult conversation to have with someone who simply was not expecting this. And oftentimes, the medical physician has to sit down with that individual or family to say, hey, I'm sorry, but we've done all we can. There's simply nothing more than I can do. How many times have you heard that? Or maybe you've heard a physician having this conversation with someone else. Or maybe a friend who had this conversation relaying what the physician stated. There's simply nothing more that I can do. No other medication I can give. There's no other interventions that could be put in place to correct this serious illness. At that point, the medical physician will most likely send out a referral to the hospice care provider because those are trained professionals who deal with seriously serious illness and terminal diagnosis. And we specialize, and I say we because, again, I've worked for hospice for many years, and I still consider myself as someone who gives my services to hospice. So when I say we, I still consider myself a hospice care provider, which is what I'm doing now, explaining hospice to the general public who's interested to find out more. When the referral is made out to hospice, one of the first things is that hospice will send out an admission team to go out and evaluate that patient to make sure they meet all criteria to come on board to hospice care. I want to step back again to the word hospice. Many people who know of hospice are like, I don't want to hear that word. It's too soon. I'm not ready for hospice. And there are some of the population who have never heard of the word hospice. Take, for example, a young lady that I've met recently, and she asked me quite pleasantly, what is your profession? And I said it to her, I'm a social worker who's worked with hospice. Now, she had this perplexing facial expression, and I was like, oh, I wonder why she has that expression on her face. And then she said to me, I'm sorry, but what exactly is hospice? I've never heard of hospice. Now, mind you, this is not a kid. This is someone in her mid 30s or even early 40s. And she's never heard of hospice. And I then asked her, you've never had any family member who was nearing the end of life who needed care at home or the nursing home or maybe in the hospital? She said, no, never. I've never heard of the service. She begged my forgiveness and said, I must sound, excuse me, stupid for that. I said, no, not at all. And to me, that was like, hey, if you're saying it, how many other individuals have no idea what hospice services are or is? It's there, it's available, but you don't know about it. And obviously, that's telling me there's a lack of um, information within that particular community to educate individuals about the services, the wonderful, compassionate care that exists for those who are dealing with a serious end of life illness. And I began to explain it to her. And at the end of our conversation, she's like, wow, I'm glad I spoke up and expressed to you. I have no idea what it was, but now I know. And I hope she's tuning in. And I thank you again for your question. And that is the reason for this show. That is the reason why I titled the show The 11th Hour Navigating Through End of Life. It is at this time, at this particular hour, that many of the calls come in for our on call staff. This is when our nurses are rushing out to go assist our patients. This is when the social worker is being called out on call to go and provide emotional support. This is when we need a CNA to go over and please, can you help out because the family's in need. Hospice is 24/7. There is no off time for hospice. Did you know that? It is a 24/7 service available to the community that qualifies for that specialized care. Again, how does one become a hospice recipient? First of all, you need a medical physician's referral to hospice to begin the process. The second thing is that the hospice admission team will come out to evaluate and assess and make sure that the individual meets the criteria to join the hospice care. And once those two, I would say the most important, most crucial, the two have been satisfied, then your staff is put in place to come and provide services. Well, where exactly do I go to get this hospice? Well, do you have a place? Mind you, these are the questions that I'm asked from family members. Where do I go and what do I do? Hospice comes to you or to your loved one or to the person who needs the services. There are several locations that hospice care tends to. Whether you are in a hospital setting, a nursing home, an assisted living, or your personal home, hospice brings their specialized services to you where you are. We come and meet you where you are. Now, there's another word that often gets floats around, and it is called a hospice house. Now, that is not a term that we typically like to use. There are some hospices who do have a freestanding hospice facility with few beds, typically 16 or less beds. Now, there may be some who have more. I don't know of one, but I know where I work for some of the hospices with 16 beds or less. They're private rooms, so there's no sharing of the room, and they're very intimate. Now, for one to get, we'll leave that topic for another time, but just to let you know, hospice comes to you. Wherever you are, they will come and provide the service. You do not have to leave your home to go and reside in a nursing home or assisted living unless there are causes and reasons for that transition. You do not have to leave your home to live in a hospice facility unless there is reason for that transition. Typically, we come to your home. So there's hospice within the home, hospice at the hospital, hospice care at a nursing facility and hospice care at an assisted living facility. So, regardless where you are, we come to you, we bring the services to you. I think we're going to wrap it up this episode, which was the primary question: what exactly is hospice and what do you guys do? What do you provide? On the next episode, I'm going to start talking about the disciplines involved in your hospice care, your hospice team. Who are the team members? And how does each one work? And do I need all the participants of that team? Wait till the next episode as we dive into it. And again, thank you for joining me on the 11th hour, navigating through end of life. I'll see you next time at the 11th hour. Take care.